I'm Dr. Natalie Woszczak, and I'm a Postdoctoral Fellow at the Center for Emotional Health of Greater Philadelphia. The current pandemic has left many children feeling scared and confused. They might have a lot of questions about the coronavirus and social distancing. You might find that even though you've attempted to answer their questions, they continue to ask the same questions over and over again. Children often ask questions repeatedly when they are attempting to process something that's difficult for them to comprehend, or if they're feeling anxious. As a parent, it can be difficult to answer these questions, especially when we are feeling uncertain ourselves. One way to help children process the situation is to create a social story with them that will both answer their questions about what's going on and start a conversation with them about their thoughts and feelings. A social story is a learning tool that can break down skills, information, or behaviors for your child into easy-to-comprehend parts. To create a social story, you can either sit down with your child and have them involved, or you can create it ahead of time and read it with them. In creating a social story, it's important to have a goal in mind for what you want your child to take away or learn, and then break that concept down into small parts. I've created one example to demonstrate to you what can be included in a social story about the coronavirus, but keep in mind, you can tailor the social story for your child to include any specific information that they might be struggling with. This type of story at the beginning might include a simple and developmentally appropriate explanation of what the coronavirus is. For example, the coronavirus is a virus that makes people sick. People who catch it might have a cough and a fever. Most people will feel better after some time. When children are feeling anxious, rather than just provide reassurance, we want to help them focus on what is in their control instead of what is not. This story can help them identify things that they can do to prevent themselves and others from getting sick. There are things that I can do to protect myself and others from getting the coronavirus. I can wash my hands with soap and water for 20 seconds. I can keep my hands away from my nose and mouth. Children are likely hearing the word social distancing, so it might be beneficial to include an explanation of this as well. Social distancing is another way we keep ourselves and others safe. We are staying home from school. Mom and dad are working from home because staying home protects everyone from getting sick. When we are outside the house, we keep a distance from other people. We won't have to social distance forever, just until less people are getting sick. To help your child process their emotions about the current situation, you might want to encourage them to include a page or two about what they're feeling. For example, the coronavirus makes me feel scared. I feel sad that I can't visit my grandparents and my friends. I miss my school. When children are feeling distressed, it's natural to want to provide reassurance by saying things like, "Don't worry," or "Don't feel sad, it will be okay." However, this is usually not actually helpful at reducing the feeling that your child is experiencing in that moment. Instead, we can validate their feelings by letting them know that what they are feeling is normal and common. Again, we can help them focus on what is in their control. You can do this by helping them identify what they can do when they feel distressed. When I feel scared, I can talk to my mom and dad. When I feel sad, I can ask to FaceTime friends. If your child has specific coping skills that they use, it can be helpful to include them here. Now, along with focusing on what's in your child's control, you can also help them identify what other people are doing to keep them safe. My parents keep me safe by making sure I stay home. Doctors and nurses are working hard to help people stay healthy. They are also looking for ways to make people feel better when they get sick. Our governor is keeping everyone safe by asking them to social distance and wear masks when outside the house. Depending on your child's age or interests, you can encourage them to draw pictures or print out pictures to accompany what's written. A social story is a great activity to do with your child. Not only does it help them process their thoughts and feelings in the moment, but it can provide them with something tangible that they can look back on over and over again when questions or worries resurface. I hope you found this useful. Please feel free to share it. My colleagues and I at CEH are dedicated to specialized care in the evidence-based treatment of anxiety disorders, OCD and related disorders, and neurodevelopmental disorders, and we are available to provide telehealth via secure internet video conferencing. Thank you and be well.